I talk to my patients about what we have here is this is the functional unit being orientated and moving through your world. And so we've got this information being combined from your head position, from signals from your neck and proprioception from the rest of your body. You've got feedback from the motion sensors in your ears, so the accelerometers, so vestibular system, and then you've got your binocular visual system. And they kind of all have to work together and match up. And if they're not matching up, then you can get some disorientation, vertigo, and dizziness. And so there's an emerging field called vestibular physiotherapy or neurophysiotherapy, and they're often dealing with patients who've had concussions or mild brain injury, and there are other kinds of triggers, and often there are visual symptoms, or their symptoms are triggered by visual movement in the visual field, where we can be of an assistance to, they may get to a certain point in therapy where the patient's not progressing as much as they would expect. So it might indicate that there's an underlying vision problem that needs to be investigated as well. Vice versa, we might come in with someone who is having these visual symptoms or visually triggered symptoms, and we kind of do a workup and start to get a sense that maybe it's something that needs to be dealt with either through looking at neck tightness, shoulder tightness, or an investigation of what's going on with the vestibular signals and apparatus. So we're sort of making referrals out based on finding things that start to become outside our sort of lane in trying to manage patient symptoms. And so this inter-referring, we're starting to get better at recognizing when a case might require another professional's help.
And you mentioned concussion, I think. So I've heard people mention like there's a whole field, I think it's Neuro-Optometry or something like that. But
Neuro-Optometric rehabilitation.
Right. I took the short version.
Yeah.
But yeah, so I mean the brain is a really like mysterious and complicated thing, isn't it? And so I think, the way that the brain works with your eyes takes a professional, I think, to understand.
Yeah, look, and there's a lot of interaction. You don't use your vision in isolation to your other senses, and so there's broadly going to be crossing over between the various sort of systems and pathways. It's not like one bit's done over here, one bit's done over here. There's this constant forward and feedback of information, and so you need to kind of work out, is the communication between the two that's being interrupted? Is it this side or this side? And so that's where the collective expertise can be really needed to really drill down into what's happening with a patient. And they all present differently. Everyone's concussion is different. So, the pathway you take with a patient's not always going to be the same.
I've even heard that migraines can lead to some sort of like visual hallucinations as well. Like I've heard the story, and this was something I saw on Reddit, so take that for what it's worth. But someone speaking about how they had a serious migraine and went into a shopping mall, and on one side out of their field of vision, on one side they could see the people moving around the shopping mall, but on the other side they couldn't see people at all. So it's like their brain was photoshopping the people out from the right side. So it's a kind of it's a really strange and mysterious thing. But yeah, I've heard that migraines also can influence your visual systems.
Absolutely. And so you get people who they're called migraineurs. So people who get migraines on a regular basis might know that one's coming because of changes in their visual field. Is often sort of patterns or auras and things that they get that they know it's their kind of signal that the migraine's about to start. Yes, you can get some quite frightening symptoms from migraines where you do lose your visual field. Some people even get one side of the body not working properly. Thankfully, they're the rarer kinds. I've had one of the field loss kind of migraines myself when I was much younger. So we just get this graying out of your vision. You've got to be careful that you don't assume it's migraine. If anyone gets anything like that, then that's again where we might network with a general practitioner. That's something that does need the care of multiple practitioners in the early phases, because you want to make sure that it's not a stroke in people who are our age and above in particular.